Your local hospital may have a consultant-led unit, or it may have a consultant-led unit with a separate midwifery-led unit, or it may have a consultant-led unit with an alongside midwifery-led unit. The consultant-led unit means that the doctors are always on hand to help with planning of care and if there's any intervention needed. On a midwifery-led unit, it's led by midwives, but there will be processes in place to transfer to the consultant-led unit if there are complications that occur. It's an important choice to decide where you're going to have your baby. And it's important to work out a plan of care with your caregivers. If your pregnancy has been low risk and very minimal complications, then there will be the opportunity to deliver in the midwifery-led unit. If your pregnancy has been complicated, or there are any reasons that staff recommend that a consultant-led unit would be better to support your needs, then you will be in a consultant-led unit. The team around you will help you make that decision, depending on the level of intervention that you might need. In the consultant-led unit, you will have an antenatal ward, a labour ward, and a postnatal ward. So in the antenatal ward, that will be for women that have complications in pregnancy, but are not yet ready to deliver the baby. And that can be for various reasons, such as if you have diabetes and you need inpatient care, if you have high blood pressure, or if you have other complications of pregnancy. Sometimes you may be admitted once and stay in hospital for an extended period and deliver your baby, or sometimes you may be admitted for a short stay and then you're allowed to go home, maybe on medication, if needed. When you are ready to have your baby, you would go directly into the labour ward area. If you haven't been into hospital yet, this is when you make the telephone call to the labour ward and tell them that you think you might be having contractions and that you might need to come into hospital. They will have a discussion with you over the telephone and they'll ask you lots of questions about how you're feeling, about baby movements, about timings of your contractions and how you are coping. They may say come into hospital, or they may say stay at home for a little bit longer and give us a call back later. It will just depend on whereabouts you are in the process of labour. When you go into hospital, the consultant-led ward, what can you expect? There'll be single rooms there. You may have your own bathroom, toilet, shower, or you may have a shared bathroom, toilet, shower, not far from your room. You should stay in that room until you've delivered your baby. Sometimes you may be put in a bay area where there are other women, and that will just depend on what stage you're at. And when you're in the room, there will be a bed, there will be a monitor to monitor baby's heartbeat, there may be a blood pressure machine, and there'll be a seat for your partner as well. And whilst you're on the ward, food will be delivered to you, but you will need to take snacks and things and also meals for your partner. On the consultant-led ward, you have the option for different kinds of pain relief. You will have access to Entonox, which is gas and air, and you may also have access to pain relief injections. Midwife will call the anaesthetist and they will come and set up the epidural for you. The anaesthetist may also be covering the main theatres of the hospital. So depending on what other responsibilities they may be able to attend quite quickly, or it may take a while for them to come. When they do come, they might bring an anaesthetic assistant with them, so it might be an extra person in the room. And the midwife will be supporting you whilst the epidural is put in place. You will deliver your baby in the room unless there are any complications that might need you to go to the theatre, such as if you need a caesarean section or a forceps, or with a little suction cup to go on top of baby's head to help baby deliver. The theatres will be in the same part of the hospital. You'll be asked to put on a hospital gown, and the midwife will go through a checklist with you. Your partner will also be asked to put on hospital scrubs. And the midwife will take you down to theatre, and in theatre you may have maybe 1 or 2 or 3 doctors to help deliver your baby. You may also have the anaesthetic, and you may also have the anaesthetist, and there may be an anaesthetic assistant as well. And there may also be a support member of the theatre staff there as well. And also you'll have maybe 1 or 2 nurses to help assist the doctor with the operation. Midwife will stay with you, and she will help and support delivery of your baby. When your baby is born, they'll be taken to a resuscitator to be checked over and just make sure that they're breathing okay. And then they'll be brought over to you for a cuddle as soon as possible. Then once the operation is complete, you'll be transferred to a recovery area. That may be back into the room where you first were, or it may be in a separate area where there are other patients as well. And then once you're well enough, you'll be transferred over to the postnatal ward, and then you'll be looked after by the midwives there.